Okay, so we talked about PRP, platelet-rich plasma. We talked about bone marrow concentrate, which is an injectable therapeutic produced from blood from your bone marrow cavity. Now let's talk about fat or adipose tissue. This is a popular one, and with physicians across the world, adipose or fat-derived stem cells are gaining popularity. Why? Well, primarily because no one wants fat. So if there's the opportunity to treat a knee problem, for example, by taking some of your fat tissue out of your body, sign me up, right? So that's driven popularity, and the data has suggested that fat actually does have a fairly rich depot of different cells, including stem cells, which we can apply to different problems, in our case, orthopedic problems. So unlike bone marrow, where we take a needle to do a blood draw from the bone marrow cavity, to collect adipose or fat-derived stem cells, we have to do a simple liposuction, just like a plastic surgeon would do, although much simpler and with much less risk and a much lower volume of fat that we actually take out. So it's a procedure where you're face up, your abdomen is cleansed, some local anesthetic is placed, and a little trocar is used to collect fat from just under your skin, typically in your abdomen or sometimes in your upper buttock region. That fat is then taken to the lab, or in some cases a medical device, where we're able to mechanically break up the fat to concentrate and isolate the cells and remove as much of the fat tissue, which doesn't have therapeutic value. So we just want the cells in the fat, not the fat droplets or the fat cells, but what we call the nucleated cells, or the therapeutic or stem types of cells. So we're able to isolate those through a very simple process, and then immediately reimplant them back into your body. So again, we use PRP for fairly simple problems like a tendonitis or a minor tendon tear, acute injuries, sports injuries, bone marrow concentrate, and adipose-derived stem cells, or what we call MFAT, micronized fat, for more complex, challenging, or difficult problems where we need a little bit more stimulation to try to drive healing and inflammation control.